So our next speaker is Hollie Smith-Charles from Arts Council England. She's the Director of Creative Health and Change, and she'll be giving us the perspective and priorities of Arts Council and Creative Health.
Hopefully you can hear and see me. My name is Hollie Smith-Charles. I'm the Director for Creative Health at Arts Council England, and I think, unless anything pops up in my chat function, I've got about 10 minutes just to give you a bit of context about Arts Council's work in this area and our focus on creative health. I'm really sorry I can't be in Dorset today. I'm up in Gloucestershire, and yeah, hopefully it's quite nice here weather-wise. So I hope you've got a nice mild day as well. But I'd be really happy to pick up some of the conversations, and I think my colleague Kim is with you as well in the room. So yeah, very happy to answer any questions further down the line if you have anything you'd like to follow up with. I'm just going to check, hopefully you can see my full screen, and then I've got a sort of presenter mode here, so I shall try and scroll through some slides. But basically what I'm going to talk about is the Arts Council's approach to creative health and some of the areas of focus that we've got, which I hope will help to inform the local conversations that you are having around what happens next in Dorset. So yeah, thank you very much to David and Gemma and the team for inviting me to come along. So first of all, Let's Create is our 10-year strategy, and in it we set out our vision for a country which is transformed by culture and creativity, in which people live happier, healthier lives. And we say in our strategy, and this is kind of the sort of thing that underpins our funding and development work that we're doing across England. And we say that by 2030 we want England to be a country in which the creativity of each of us is valued and given a chance to flourish. A country where every one of us has access to a remarkable range of high quality cultural experiences. So whatever your age, wherever you live, we want people to be able to experience culture and creativity. And health weaves as a thread through all of this. Our strategy mentions health 15 times, and we fundamentally believe that access to culture and creative activity is a key part of living well, of being happy. So it's something that we are looking to promote throughout the work that we do. Just to clarify, what do we mean by creative health? We think that culture can contribute to healthy lives, whatever your life stage. And so that might be from prevention and kind of personal care and looking at healthy habits and how we integrate creativity as we grow up. It could be through treatment and recovery, so looking at some specialist providers and working with health partners to really support people in their treatment. And we know, so where I live in Gloucestershire, for example, there are there are treatment pathways for certain conditions where creativity is used as a method for supporting people with different health conditions. So youth mental health, for example, managing long-term pain, looking at falls prevention. There's loads of evidence around how the arts can help to support the treatment of conditions. And then also we work in acute care, and I'll say something a bit more about that, so particularly working in hospital and residential care and working with the National Arts in Hospitals Network. So in June 2022 we published our Creative Health Plan, and what this does is kind of bring together all of the strands of work that we've been doing. As I say, health has been a key part of what we do since the Arts Council, well, before the Arts Council even existed. It was part of our kind of founding principles. But what we try to do in this plan is to set out our areas of focus. And there are 3 P's really that inform the work that I do and that our teams across our different areas do. So first of all, partnerships. So we're really looking at how we can work strategically with health and social care sectors, and including local authorities as well, to really integrate that, to kind of build it into that systems change, and to look at how creativity can weave into the health outcomes that are important for local places, and also to link up at the national level and kind of inform policy across the NHS. And we work with lots of partners to try and do that both at a systems level and a national level. The National Centre for Creative Health are kind of a key partner in that, and I'll talk a bit more about their work in just a sec as well. And I think Alex might be with you, so hopefully you'll be up to speed on that. We are the development agency for culture. We're really interested in practitioners, so we're looking in particular on the skills and well-being and diversity of creative practitioners in this field to make sure that, as we hope the demand grows for this area, that the supply side, if you like, the artists, the producers, the kind of animateurs who are behind all of this work and are really key to delivering high quality creative health interventions, are as supported and trained as best they can be. And then finally, we're looking at how we can embed this work in our place-based approach, and I'll say a bit more about that in a moment. Oh, hang on. How do I do my slides? There we go. So just on that place one, that third key, we're really trying to weave it into our work, and all of our area teams are kind of looking at how that we can link up health and culture, kind of join those two worlds together a bit more. So we're particularly looking at what are local health priorities and partnerships and projects that are happening. How does culture inform health plans and vice versa? You know, where is their representation on different health boards or culture boards, and what can we do to support those kind of conversations? We're looking at promoting the cultural sector's buildings and local practitioners as assets to support healthy communities. There's a wealth of experience and skill across Dorset. Buildings such as libraries, which are really key community hubs, can act as brilliant kind of creative health places. And so we want to help develop those relationships and make sure that those, sorry, I hate referring to people as like assets, but you get my point, hopefully. You know, how can we support local health and wellbeing through links with creative practitioners? We think that recognising health and wellbeing metrics as valuable outcomes for place-based strategies is absolutely valid. It's as much about you know, the kind of the happiest thing you can do is, you know, take part in creative activities. So how can we measure that and evaluate that as part of cultural development? And then finally, we're looking at how we can advocate for creative health. So through our communications, through understanding what our partners are doing, and supporting those campaigns. We don't have a separate budget for creative health funding. I think that's a really important thing to kind of get across to everybody. What we see is that this is part of our funding. So through we have a lot of national portfolio organisations who are delivering creative health, and that's a kind of 4-year funding stream. We also have National Lottery project grants that are open now all the time. And so we're looking at how we can support creative health through our National Lottery project grants, and also developing your creative practice, which is aimed at kind of individual practitioners. So this is just some of the things that we're looking for. So we really want to centre creativity as a core component of the project. It's not just an add-on. We want to see at how you're responding to an identified health need. Everything we fund is, you know arts and culture is great for well-being. So we really want to look at how a creative health programme is tackling an identified health need. Of course, safeguarding of both the participants themselves, but also the practitioners. If it's quite a demanding environment, we want to see how you're looking at that. Appropriate evaluation methods, and also, is there match funding or tangible support from partners, particularly, you know, in health and social care, public health. We want to see how all of those worlds are joining up. I've talked for too long. I've realised I've got 10 minutes already, so I'm going to whiz through the next slides just to give you a bit of a sense of some of the wider context that we're doing. But I should say the last slide has got a link to our website, so you can read more about all of this by visiting our website. So the Creative Health Quality Framework is a really helpful kind of summary of what does good look like in creative health projects. And this has been developed by the Culture, Health and Wellbeing Alliance. And so you can dig into those 8 strands of what does a good project look like on their website. the National Arts and Hospitals Network as well. This is a network for arts managers who are working in NHS trusts. And so it's a way of sharing good practice, sharing skills. We've supported them last year with the National Health Stories project. They're working much more closely and developing much more of a kind of strategic relationship with NHS charities together. So it's a really great way for health partners to kind of dip their toe into this world if they want to find out more. We're also supporting, and hopefully the National Centre for Creative Health can tell you a bit more about this, but Creative Health Associates, and this is looking at a step change in how we build those partnerships between culture and health. So it's about exploring opportunities, brokering stronger connections, and improving understanding about how we can contribute to one another's goals by working together. And this is, excuse my terrible hand-drawn red blobs on there, but this is where they're all located. So there isn't a Creative Health Associate based in Dorset, but the Devon Creative Health Associate will be able to work across the whole South West region. So it's worth just looking at some of the mapping that they're doing and the connections that they're building and sort of sharing good practice. And then finally, I just wanted to mention the Creative Health Review. So this was through the All-Party Parliamentary Group on Arts, Health and Wellbeing and the National Centre for Creative Health. It was published back in December, and it's really looking at how national policy and also combined authorities, local government, can embed creative health into there. What are the next steps for creative health in terms of policy? So it's well worth a quick read of the exec summary of that, or if you really want to dig in, there is a wealth of information in there about kind of case studies and the evidence for this and why it works and why it matters. This is my last slide. This is just a link to our website, and as I say, there's loads of information on here. I think the evidence base for this is really growing. There's loads of great case studies as well, and stories about the impact that creative health has had on people's lives. We see this as a really key goal. Health and happiness is a really key goal for investing public money. So we'll be really interested to see what comes out of today's conversations and how we might be able to support that going forward. Thanks very much.